really urgently needed some paperwork to be picked up in Ottawa, and I messaged my friend Sehjal, and I said, I really need those forms. I'm sorry to ask you to go pick them up in person. I know you're a Harvard-trained Master's of Public Health and family physician and climate action superstar, and she said, well, I'm just a girl from Saskatoon. So from Saskatoon through Harvard and Ottawa, Dr. Sehjal Bhargava.
Hi everybody. I'm scared I'm going to be too short for the podium, so I'll stand over here. It's really nice to be here with you all today, and I just want to take a moment to acknowledge that we gathered today on stolen territory and stolen Indigenous lands, and as well as that we are privileged today to be talking about issues that people who are in regions of crisis and have their human rights, put into trial and tribulation don't have the privilege to talk about. So with that privilege in mind, we go forwards. Okay, if this works, we go forwards. Will help. Oh, there. Oh, that's my title slide. Great. Okay. So my name is Sehjal Bhargava. I'm a public health preventive medicine resident and family doctor. And I think today what my talk about is you've heard this idea from other people who work in healthcare, Dr. Sarah Cook, as well as the Senator Kingston earlier this morning, that when we think about healthcare, it needs to come from primary care. The climate crisis is associated with so many comorbidities, and we know that the World Health Organization has stated that the climate crisis is the number one health threat of the 21st century.
Point at the computer.
Oh, thank you. So just a quick disclosure, I'm not being financially compensated by anybody, but I do want to disclose that I am a primary care physician as well as a public health and preventive medicine specialist, so I do have a bit of a bias when it comes to what I'm talking about today. Sorry to the surgeons in the crowd. So we cannot lose sight of the reason that we are on our journey to decarbonization. People are, the reason that we do this work, and today I hope that I can make you think about how we got to the system that we have today, and to consider the root causes and future interventions that we might apply. So a bit about me. I've spent, as Will mentioned, a lot of time in Saskatchewan and in medical training in hospitals. And I wanted to share a few anecdotes about, the experiences and the reflections I had while working at the end of the system, which is hospitals or tertiary care. So I remember meeting a patient on my emergency room rotation that I concluded had just gardened a little bit too hard and had strained a muscle in her neck. But we had to rule out the number one cause of neck pain that presents to the ER, which was a vertebral artery dissection. So we ordered this lady who had a muscle strain a CT angiogram. I treated a patient's osteomyelitis that is a bone infection in their spine that comes from IV drug use with 6 weeks of IV antibiotics, and I discharged them back to the homeless shelter that they lived in, and I said, just make sure you follow up with your family doctor, and they replied, who? I saw patients get prescribed a new inhaler every time they moved a room, and we know that inhalers, especially the puffy ones, are not good for the environment. I watched as a surgeon went, that's not the tool I wanted, and the sterile single-use plastic tool went right in the garbage, and I sat beside the garbage cans as we threw away piles and piles and piles of single-use plastics. I realized that a lot of the patients that I met in the emergency room throughout my time there were not emergency type cases, they were primary care type cases. And I asked people, how did you choose the emergency room? And they replied, it would take too long to see my family doctor, or I don't have a family doctor. So this is one of my favorite frameworks, and it basically ties together public health and preventive medicine with planetary health and systems thinking. Andrea McNeil is an oncologic surgeon from the University of British Columbia, and in this framework, she states in her cooperative state that the number one thing we can do for planetary health and sustainable healthcare systems is to reduce the demand of healthcare. Just take a look and just really contemplate that. So, hospitals are a slippery slope that, once somebody ends up in the emergency room and they, miss primary care, they could not access primary care, it's a slippery slope to some over-investigations, to no one's fault. It's to make sure that you're safe and that the patient has nothing to be concerned about, but it often leads to admissions. And when somebody uses a hospital bed, it means that they're using all of the resources that come with that. whether that be investigations in the ER, like think everybody gets, maybe a CT, maybe an X-ray, blood work, blood tests, antibiotics, medications. All of that is extremely climate intensive when it's done in an inpatient setting. And you can see that this statistic shows that, this kind of puts it into terms that we can understand just how much one overnight hospital stay in a bed in a hospital can cause in terms of our emissions and our contribution to the climate crisis. So the question I get the most is, are you accepting new patients? And I have to unfortunately say, no, I'm just a locum and I'm still in my residency. I can't take on any patients. But none of these are sustainable options. Like when we look at the lack of primary care that people have in Canada, the alternatives are walk-in clinics, virtually or in person, as well as emergency department visits. And these are not sustainable or the best, healthiest way for patients to access care. It's through primary care and system redesign. But what are the barriers to system redesign? So this is my model I came up with, UOD. Sorry, it's a terrible acronym. But why are we stuck in this system, and why are we presenting to hospitals, and why are hospitals the center of our healthcare system? UOD, okay? So untimely access to primary care. Patients also say that they have a lack of access to primary care. A lack of medical students wanting to become primary care physicians, and if you want to talk about stigma, I'm here to talk about that too, find me after. Aging population, a lack of community-based resources, a lack of resources to age in home and die in home, as we all mentioned would be our priority today, and difficult to access affordable in-community outpatient mental health care requiring hospitalization for emergency rooms. Okay, I'm almost done. Okay, so when we end up looking at the political systems that we live within, and when we look at the perception of people, this survey really made me think. People actually believe that we need emergency rooms. More emergency rooms might be the answer to our healthcare crisis. And that's fine. People are responding to what their needs are. People are responding to their perceived needs. But we know as systems thinkers and systems leaders that these are actually reflections of our political determinants of health. When we look at political funding, it comes in 4-year cycles. It's really hard to implement sustainable solutions that have payoffs that are 20 years down the road when you need to be reelected. So as leaders in healthcare, people who understand preventive care and the necessary need for that, we need to be advocating at a systems and political level. My parting message is this. This is from the Andrea McNeil's paper that in an effort to decarbonize our health systems, we need to couple strategies to reduce disease. Healthy motion begins with public policy, and that we need health in all policies. Thank you.